Hi, I'm Riemenschneider. I'm here to talk to you about a problem that can be a huge problem for some people, and that's urinary incontinence. It wasn't too long ago that there was real progress made in dealing with urinary incontinence in women. And what we learned there was that support systems for the pelvic floor can make a big difference in how efficiently they can control their urine. In other words, keep them from having wet pants. The sling, the same basic concept that was used in women, in the past few years has been adapted for men. And in this case, it's called the Advanced Male Sling. What it does is it provides support for the shutoff valve or the sphincter, and particularly in people who have had prostate surgery. There can be other problems, but prostate surgery for cancer, many times, although it eliminates the cancer, really alters the support system for the bladder and the shutoff valve, the sphincter in the male pelvis. This is actually a female pelvis, and this shows a sling that now has been used for well over a decade and has made many women much more comfortable with their lives by simply giving them the ability to be dry. How does it work? Well, these are muscles of the pelvic floor, and this sling, which comes around the tube through which the urine passes, called the urethra, enhances the support of the shutoff mechanism or the sphincter and can do great things for them. Well, here it is in men. This is a sling that we have learned that if we approach diagnosis and can find the right group of patients, meaning that there are some limitations to how severe the urine incontinence might be, this sling could be right for you. Probably 40% of men who have incontinence, and particularly if it's involved prostate surgery, can be made very dry with this simple, short operative procedure. Now, here we go again, the pelvis. And in this case, of course, is the urethra, and down in this region is the area where the prostate and the urethra that comes to the outside connect. And it's this area where the mobility problem exists. So by simply passing this sling to support this system, we can create the magic of continence. Now, let's look at this carefully. This is the sling. It's a simple device made out of a particular type of thread or cloth. This whole event takes less than a half hour of surgical time. The incision is closed, and the patients go home that day, shortly after surgery. So essentially, here's our sling. This cloth, which we call a sling, is placed around the urethra, and then when it is snugged into the muscles through which it passes, it supports the urethra, and the net result of all of this is continence, dry pants. I really like this operative event, and I can't tell you how pleased I am to be able to share this with you. Patients come to me and they talk about surgery, and they're always worried about how complicated it is. This is simple surgery, but let me tell you, our patients, possibly you, will be one of the happiest people around if you fit this group that we can use this great treatment for. We at Riverside Urology want you to know that we're here to serve you. Contact us through our website, and we'll get back to you promptly. and we'll share with you the information that you need to know. Thanks.